Good day, I am Dapsin Garces from N13 and I am going to assess the appearance and mental status, skin, hair, and nails of the patient. Basic concept. Assessing the appearance and mental status is an evaluation of the client's look and mental state in relation to his/her culture, socioeconomic status, and current circumstances. Assessing the skin, hair, and nails is an overall inspection of the condition of integumentary system that provides clues to client's general health condition. The disease and disorder of the integumentary system may be local or caused by underlying systematic condition. Objectives: assessing the appearance and mental status. To determine the client's current mental state, to determine reliability of the client's responses throughout the rest of the examination, to acquire information regarding client's level of condition and emotional stability. Assessing the skin, hair, and nails, to obtain information about the nutritional and hydration status and overall health of the patient, to obtain information associated with certain systemic diseases, infection, immobility, excessive sun exposure, and allergic reactions. Then preparation, introduce yourself and verify the client's identity. Explain to the client what you are going to do, why it is necessary, and how the client can operate. Good day, ma'am. I am your nursing student for today and I'm going to assist your appearance, mental status, hair, skin, and nails. Then, perform hand hygiene and observe appropriate infection control procedures. Provide for client privacy. Then, procedure for assessing the appearance and mental status. Observe body build, height, and weight in relation to the client's age, lifestyle, and health to assess the client's current BMI status. The next is observe the client's posture and gait, standing, sitting, and walking. Ma'am, can you please stand up? And walk, ma'am, please. You sit down. The client should appear relaxed with erect posture and coordinate movements. Observe the client's overall hygiene and grooming. Relate this to the person's activity prior to the assessment. In assessing the patient, we should be mindful of the examination setting or the environment as we observe the patient attire or degree of cleanliness, and also we should be mindful of the different considerations such as cultural considerations and older adult considerations. Denote body and breath odor in relation to activity level. To sense if there is no body odor related to work. The next is observe for signs of distress in posture or facial expression. We may observe any grimace or bending over which indicate pain, or we can also note if the patient is wincing or having a labored breathing. We will note this finding as abnormal findings. Then note obvious signs of health or illness. We can observe this by checking the patient's skin color or through the patient's breathing. Colored skin is noted as an abnormal finding. Then assess the client's attitude. To assist, we should observe if the patient is cooperative throughout the assessment or if the patient shows a negative attitude. Then note the client's affect mood. Assess the appropriateness of the client's responses. Inappropriate responses of the clients may indicate further assessment for psychomental condition. Then listen for quality, and organization of speech. This is to assess the patient's level of speech. Speech will be in a moderate tone and it should be clear. In assessing the client's speech, we should consider if the patient is an elderly. The next is listen for relevance and organization of thoughts. To check the patient's organization of speech, note for any confusion when talking or flight of ideas and note it as an abnormal finding. The next is document findings in the client record. This is for the baseline purposes. The next is assessing the skin. Materials, equipment, millimeter ruler, examination gloves, clean gloves, magnifying glass. Preparation, assemble equipment. Procedure for assessing the skin. inquire if client has any history of the following: pain or itching, presence and spread of anal lesions, bruises, abrasions, or pigmented spots, skin problems, associated clinical signs, problems in other family members, related systemic conditions, use of medications, lotions, or home remedies, excessively dry or moist feel to the skin, tendency to bruise easily, any association of the problem to a season of the year. Some of the signs may be related to a pathogenic skin condition. Abrasion and bruises may indicate that the patient had an incident, or the dryness of the itchiness of the skin is a common concern for the obese patient. Then inspect the skin color and inspect uniformity of skin color. This is best assessed under natural light and in areas not exposed to the sun. During inspection, the client's skin should show evenly colored skin tones without unusual or permanent discolorations. We should keep in mind the cultural considerations. Then assess edema if present. Take note of the location, color, temperature, shape, and the degree which the skin remains indented or pit with pressed by a finger. To assess, we will press the skin and it should rebound and remain indented when pressure is released. Then inspect, palpate, and describe skin lesions. Then if you found some lesions on the patient, we should use magnifying glass. And a ruler so that we can know the size of the lesions of the client. Apply gloves if lesions are open or draining. Describe lesions according to location, distribution, color, configuration, size, shape, type, or structure. Observe the skin surface to determine any abnormalities and then take note of it. Lesions may indicate local or systemic problems. Also, gloves should be worn to protect oneself from the discharge and to avoid infection. Then observe and palpate skin moisture. We can check under skin folds or in unexposed areas such as the axilla. This moisture and dryness of the skin may vary depending on the recent activity the patient had. Note for excessive and decreased moisture and document it as an abnormal finding, as this may indicate hyperthermia and dehydration. Palpate skin temperature. Compare the 2 feet and the 2 hands using the back of your fingers. Skin is usually warm if a very warm skin is felt. It may indicate that the patient is in febrile state. Note skin turgor by lifting and pinching the skin on an extremity. When pinched, the skin should spring back to previous state. If it stays pinched or moves back slowly, then note this is an abnormal finding. Decreased turgor is seen in dehydration. Then document findings in the client's record. Draw the locations of skin lesions on body surface diagram. This is for the baseline purposes. The next is assessing the hair. Material, clean gloves, procedure for assessing the hair. Inquire if client has any history of the following: recent use of hair dyes, rinses, or curling or straightening preparation, recent chemotherapy, presence of disease, to obtain reliable assessment. Then inspect the evenness of growth over the scalp. Then hair loss may indicate stress, anorexia, infection, and etc. Then inspect hair thickness or thinness. Brittle hair or excessive hair may indicate vitamin deficiency. Then inspect hair texture and oiliness. The hair may appear silky and resilient as a normal findings. Abnormal finding for this is a brittle and dry hair. Note presence of infection or infestation by parting the hair in several areas and checking behind the ears along the hairline of the neck. Scalp infections occur when bacteria or fungus enter damaged skin or hair follicles on the scalp. Then inspect the amount of body hair. Check for unusual growth elsewhere in the body. If hirsutism may be seen in women, we will note this as an abnormal finding. Then document findings in the client record. Use a form or checklist supplemented by the narrative notes when appropriate and then report any abnormal findings noted from the patient to the physician. Procedure for assessing the nails. Inquire if the client has any history of the following: diabetes mellitus, peripheral circulatory disease, previous injury, severe illness, and this is to obtain accurate data. Then inspect fingernails plate shape to determine if its curvature and angle. This is normally as 160-degree angle. Clubbing of the nails is noted as an abnormal finding, including a spoon nail, as this may go along with iron deficiency. The next is inspect fingernail and toenail texture. Because the nails are usually hard and smooth. Note for excessive thickness and thinness of the nails and then document as a deviation from normal. We should keep in mind the considerations. Dark skinned clients may have thicker nails. Then inspect fingernail and toenail bed color. Nails are highly vascular. Pink tones should be seen in light skinned clients, and dark skinned clients may have brown to black pigmentation. Then inspect tissues surrounding nails. Epidermis should be intact. And then note for paronychia or ingrown nails and document this as an abnormal finding. Then perform blanch test of capillary refill. Press 2 or more nails between your thumb and index fingers, looking for blanching and return of pink color to nail bed. Nail will blanch when pressed but immediately return into its normal color when pressure is released. Then document findings if the client recorded. This is for baseline purposes. That's all. Thank you.